Okay.
Oh, that's nice. Don't be scared.
Here we go.
Hello everyone, my name is Dr. Mo and I'm a general dentist. I'll be reacting to Chris's getting all my wisdom teeth removed surgery recovery vlog.
Good morning, y'all. Welcome back to another video, another vlog.
Wow, these are really white teeth.
I'm going to be documenting a special occasion. You guys know by the title. Yeah, I'm getting my wisdom teeth out.
So let's take a look at the x-ray together, and we have her upper wisdom teeth partially erupted. The teeth seem to be aligned just fine. So in the x-ray, when you look at it as an image or as a picture, we're looking at the opposite side, meaning this is right side. This is left side. I know it's weird, but yeah. So the upper wisdom teeth seem to be partially erupted. If you notice, so you have your first molar, second molar, and then your wisdom tooth. Your first molar, second molar, and then your wisdom tooth. And these appear to be partially erupted as well. This one seems to be erupting at quite a bit of a wrong angle, impinging on the adjacent tooth. One of the reasons this may happen is perhaps there's not adequate space in the jaw, or it could just erupt in the wrong way directly. And this one as well.
My teeth were literally coming in or impacted, all that. The pain went away.
So yeah, impacted wisdom teeth is, as we saw, when the wisdom tooth is trying to erupt, it's erupting, meaning tooth eruption means a tooth trying to come into the mouth. It can be erupting in a wrong angle or in the wrong way.
So I ignored it. Do not do that because it'll come back. And it did. The same sort of pain came back on my left side about 2 weeks ago. And this was literally days before I was supposed to hop on a flight to go play in a tournament, and then I had another trip after that. So like it was like terrible timing. This time around the pain was so much worse. I even had an infection that caused my cheek to swell. Luckily I was able to squeeze in an appointment with the oral surgeon.
So the pain may come and go, the swelling may come and go, but you need to address the root cause. The root cause in this context, I'm assuming it's the wisdom tooth that she had problems with. So we need to deal with the root cause, but the swelling pain, it may be on and off, and may come and go.
And they looked at it and just gave me like a special mouthwash to help fight the infection. So at least the swelling went down and eventually the pain went away. I knew that 10 minutes. I'm hungry, thirsty, haven't been able to eat or drink anything since midnight last night, so I don't know when I'm gonna get to eat something. Probably not for like a few hours.
Thank you. All right, to be continued.
So she arrives at the clinic, I'm assuming. Okay, so they're done with the removal of wisdom tooth or wisdom teeth. I don't remember her saying how many she's going to remove.
I hate it.
Okay, so it looks like they removed at least the two lower wisdom teeth. They place a form of, now I place much smaller gauze than this. I don't like them being dangling like outside in this way. So there is a gauze that I place on the location of the extraction site with a specific purpose to help control the bleeding.
Okay.
You want to rest your head back for me and keep your chin up? Take this out. And bite down with.
Yeah, so do you see the second one? It's like smaller, it's not dangling this much. I mean, I wish if it was just used from the beginning. Both will do the job, but I think the second one is much more tidy. Like
Pressure, okay?
he says, bite on it with pressure. Pressure because we want to help control the bleeding. So she says it wasn't that bad. This means she was anesthetized adequately and the procedure was smooth. Good for her.
Okay. It's tired. I'm hungry. Hungry. Oh, I'm not recovery area. Again, I'm so corner, but it's something I found in pizza. I think my sister's car got hit. I'm not recovered. Oh,
So I hope her sister is fine. Looks like she had an accident.
After like the 7th day or so, that's when patients start progressively getting better day by.
Yeah, I mean, I wouldn't say after the 7th day, but definitely, like, you will gradually get better. The swelling itself may not directly start on day 1. It may start slowly, like from day 2, 3, and increase a bit. Its first week is gonna be difficult, but the rationale is you will gradually, or you're supposed to gradually, become better, granted you follow the instructions from your dentist, oral surgeon, or healthcare professional.
Physical activity, take it easy for the next 5 days to a week. No running, sports, weightlifting.
Yeah, I agree with this. Avoid vigorous exercise. All of these things you're supposed to rest. Looks like he doesn't like that instruction.
Things like that, okay?
Like,
Literally.
nothing?
Because she was talking about tournaments at the beginning. I'm not sure if it's sport tournaments or something.
Okay.
Yep, okay.
Yeah.
And let's see, last thing.
She's gonna cry.
Just relax, watch some movies, TV, you know. And we're pretty much set. Is she good to go now?
Yeah.
Thank you so much.
Anytime. Have a great one, okay?
You guys are all set?
Future, whenever you get a new car or whatever it is, you guys. How much you pay for it?
Did you vlog it all when it happened?
Of course not.
Oh, I thought you said, of course I did.
No.
So instead of saying get well soon or I hope you're okay, she's like, did you like vlog it when that happened?
No.
Juicy footage.
If I feel like it, Kris will enter the pictures of what happened at my door.
Bye. See you at home.
Bye.
Oh my gosh, y'all. The swelling.
So
Oh yeah.
day 0, she's saying right after
It's picking
the
up.
procedure, and if you noticed, as I said, the swelling will gradually pick up. It's not immediately right after the procedure. It takes a bit of time, and it can increase slowly on the first few days.
It's really starting to settle in. We have to go pick up my medication and like my special mouthwash, but they forgot to include the painkiller. So
Oh my God! So they forgot to give her a painkiller. You could contact your clinic, or quite frankly, if the clinic is really far, you could see a healthcare professional in this regard. I mean,
my sister's gonna help me get that from Kaiser. I took some Tylenol for now, ice for a bit.
so sometimes what happens with regard to a prescription, I'll say, for example, for my clinic, let's say I prescribe a medication, it's registered in the system, and then the patient can take that prescription, like the process is digital, and they could go to a pharmacy that either we work with or the insurance covers or something like this, and she could get her medication quite easily.
And I'm like really hungry, so I'll probably have an applesauce right now. Got these.
Some medical or dental centers will have a pharmacy in-house. I'm talking about a process where like the patient left and or there's no a pharmacy to take the medication right away from the same place where they had the procedure.
Is that Walgreens? I've been posting on my story announcing that today I'm getting my surgery, or that I got my surgery. And so far I've gotten a ton of responses. I need to look through all the messages, but a few people have said that the swelling gets even worse by day 3.
So as she just said, the swelling may get worse by day 3. Again, if you go back in the video, we addressed many times that The swelling may gradually increase over the first few days, right? We just mentioned this. It could build up slowly again over a period of time, as the dentist or her doctor said that I guess it was an oral surgeon, that everything's gonna gradually subside like following a week.
Which is a little concerning.
Crap.
So she's having a soft diet because that is what is advised following wisdom tooth removal.
What?
Oh, you're eating already?
Am I not allowed to?
So she says, are you eating already? Because generally speaking, at least like for the first hour to preferably like first few hours following a tooth removal or wisdom teeth removal, it's advised to not eat actually.
I fell asleep for a little bit, which is nice. It's like 4:50. I don't want to sleep too much and then not be able to sleep tonight. So,
yeah, it's okay, of course, it's okay to sleep, help with the recovery process.
I'm gonna try to stay up for at least a couple more hours and just go to bed early. Yeah, this is painful.
Again, as we mentioned, the soft diet. Okay, so this is day 1 post-operatively, and to be completely frank, yeah, there's a swelling there. It's not too horrible or too bad, and she will show also how to help reduce that swelling, and I will comment on what methods she use.
Oh my god. Oh, I look horrendous. Oh, this is the only thing that feels right in the world. I really didn't want to believe it, but the swelling does indeed get worse and worse. I've already had so many moments where I'm like, is my face ever gonna look normal again?
Yeah, hopefully it will. I mean, all of these things are supposed to be temporary, following the wisdom tooth removal or removal of any tooth. And did I just notice a cat or something there, or a dog?
It doesn't make it any easier that like I have to look at myself when I vlog, and I have this giant mirror next to my desk. Everyone's saying just to continue icing throughout the day, and in time the swelling will go. It has yellow watermelon, which is new.
So what you're seeing is cold application. Cold application will help in alleviating or reducing the swelling, okay? The cold application, generally speaking, should be on and off, meaning like a cold application for 20 minutes and then resting for 20 minutes, not the entire time. Also, follow just directly your dentist or oral surgeon instructions. I just give a general like tips for educational purposes.
Really good though. Tastes like normal watermelon, but yeah, watermelon and then like a tropical fruit mix. Oh, fruit smoothies I think are probably like one of the best things that you can have. It just tastes so fresh and it feels like it gives me life when I sip it.
Yeah, I love fruit smoothies also.
Not supposed to use straws. I miss using a straw though. Straws. You're not supposed to use straws. I miss using a straw though.
Yeah, so you're not supposed to be using a straw, and that is completely true. The rationale behind this is because I'll just simplify it for you. We have a tooth that is to be removed, okay? Now we remove this tooth. Within this context, it's a wisdom tooth. It could be any tooth, okay? So what do we have? We have an extraction socket. In this extraction socket, we will have a blood clot formation to fill in that space along with other healing connective tissue that comes in. Now, whenever you use a straw, due to the sucking motion and using of the straw, it is very possible to dislodge that blood clot. When you dislodge that blood clot, now what do you have? You're left with the extraction socket site, right? And that socket, we call it the dry socket. Dry socket is in extremely painful condition. It is one of the most painful experiences you or anyone else will ever have in their life. Ask anyone who ever had a dry socket before. It's extremely painful, so follow your dentist's instructions. Unfortunately, I just want to add that even if followed or all the instructions properly, there's also a risk for dry socket to happen. But when you follow the instructions, you're trying to minimize that risk. Other things may contribute to that risk is spitting or rinsing, switching around the water liquids.
My god, guys, look at this cheek. That is insane. Insane.
Okay, so it definitely is a prominent swelling, and as you can see, as we progress with time for the first few days, looks like the swelling just becomes a bit more exaggerated over time, and that is just a message for you to not be that extremely concerned with this, as it can normally happen this way. I have removed a lot of wisdom teeth where patients did not, of course, have a swelling that is exaggerated this much, or even like just extremely mild swelling. So not every person who will remove a wisdom tooth will have a huge swelling like this.
A surprise was waiting for me at the door. My sister sent some frozen yogurt from our favorite place, Easy Breezy. I need a smaller scoop. Oh, that's so good. When I wake up, I'm like, I need to have this on my face.
Sorry, day 2 of the recovery. Let's see what
Swelling has not gotten any better. If anything, it's just like even worse on my left side. I'm really going through it, y'all. I'm trying to get something in my system so I can take my.
As the first few days progress, as we said, the swelling may get worse.
Medicine. We're gonna have another unsweetened applesauce. I need to go to the store and get more of this because I'm on my last. Well, this is my.
I think she loves applesauce or something.
Actually, that's a lie. I did wake up earlier and I've been editing and I'm really close to finishing a video. If I can get that posted by today, I'll feel very accomplished. Face, you can't even tell. I'm surprised at how much the swelling has gone down on the left side of my face, but the right side.
So day 3, I can see this swelling is calming down a little bit, which is a great sign.
It's still got some stuff going on. It's also bruising a bit, which is normal. Overall, you know, we're getting there. Try not to stress too much about it. I just went on a walk with Elvis. Felt nice to just be outside. The sun is out. Had my visor on so that I could protect my face because I was also wearing a mask. Good for the swelling, perhaps. We shall see.
So they're talking about the pumpkin having health benefits. Yeah, I mean, pumpkins are good for your health, but I'm not sure about the reference, like goodnet.org. So she just made a quick search. Ideally, you would want some high quality studies. I have not researched extensively pumpkins. Do your own research. Look at high quality studies if these things help. I mean, yeah.
Let me just tell you. If you are going through wisdom tooth recovery, do not go to the grocery store if you can avoid it, because I have never salivated so much. Everything looks so good. I cannot eat like 90% of what's in the store. Yeah, that was torture. Bread, but that's for my dad. The rest is mostly just stuff for smoothies. I've been
Not sure. Looks like eggs and some soft food. I mean, it's fine.
That's good. It's been such good weather this week. Part of me is sad because I can't really be like out doing things and whatever, but I'm still able to, you know, go on walks. I just went on a walk with Elvis. We went for like 40 minutes, slowly but surely going down. I really can't tell.
So that looks like really hot food. I mean, I would avoid hot foods following wisdom tooth surgery.
Reading
Hot as in high in temperature.
Layla by Colleen Hoover. I haven't picked this up in a while. I feel like this week would have been the perfect time to like crack down on a bunch of whole day so far doing self-care things. I went on literally a 5-mile walk, which was amazing. It was the first time that I left the house without wearing a mask. If you were to just see me first glance, can't.
Okay, so that's all for today. Thank you everyone for watching. Dr. Mo Dentist. Don't forget to turn on the notification bell and like the video, leave a comment down below, and peace.